Hello, Barbara Loomis, the Alignment Monkey here. Last time I talked about how breathing mechanics can affect the large intestine. I did that by using my arms as a demo for the colon, but this time I'm going to use the elastic band, and I'm going to talk about how rib thrusting can affect the colon as well as the right ovary and knee pain. And to do that, we're going to focus on the right side of the colon. This is the ascending colon. The cecum is on the right side, right about here, and that's where the small intestine goes into the large intestine. And the cecum is anchored through the parietal peritoneum and anchored to the iliacus muscle. There's also a ligament of Clayette in 60% of the women that attaches to the right ovary. Now, underneath that ligament, the genitofemoral nerve passes through and can, if it's impinged, it can cause pain in the thigh and the inside of the knee. And so with rib thrusting, if you think about it being, the colon being anchored up here and anchored here, and ideally the ribs are in a plumb line over the ASIS, but if you rib thrust, and that's a habit a lot of us have when we want to stand up straight, but we're actually doing damage to our spine and interfering with the mobility and motility of the internal organs. And so a rib thrust would be when you thrust your ribs forward. So you can see how that can cause extra tension when these two areas are anchored and you thrust, so you're actually increasing that length between. And so then that ligament can impinge on the genitofemoral nerve and cause that inside of the knee pain. It can also cause issues with the motility of the cecum as well as issues with that right ovary. So just another interesting way that alignment can affect the internal organs. So pain does not always mean that that's where the problem is. All right?